Welcome to the Learn Idaho 2025 Medicare Update. I am joined today by Brad Talbutt from SHIBA, the State Health Insurance Benefits Advisors. Brad has been a certified Medicare counselor with the Idaho Department of Insurance for the last 9 years. As a member of the SHIBA team, he has helped more than 5,000 Idahoans understand Medicare and qualify for benefits that reduce their healthcare costs. As a caseworker, Brad helps to resolve conflicts between Medicare plans and their customers, saving hundreds of thousands of dollars for Idaho citizens. Before we start today, just a reminder that this content is provided for general information purposes only and is not to be considered legal, financial, or health advice. Please consult with your legal, financial, healthcare, or other service providers before taking action based on this information. With that out of the way, Brad, welcome and thank you for joining me today.
All right, so thanks for having me. As Dara said, I'm with the Idaho Department of Insurance SHIBA program. SHIBA is a Medicare counseling service provided by the state. It's intended to provide Idaho citizens with free, unbiased Medicare counseling resources. So we're an information resource as well as advocacy and statewide program. Every state has a SHIP or SHIBA program, something like that. Part of our funding comes from the federal government, but the lion's share from the state of Idaho. We do workshops, presentations, one-on-one Medicare counseling, and as Dara said, we assist with questions and problems about insurance coverage and denials of coverage and what have you, and help to resolve those when they occur. Most importantly, what we don't do, I think, is good to know. We don't sell insurance. We're a state government agency, so nobody is licensed insurance agents here. We don't recommend companies or agents, and we don't recommend insurance plans. What we do is help you understand all of your options, show you all the options that are available when necessary, and allow you to be educated well enough to make your own good choices. Okay, so one of the things I promised to do is to simplify Medicare. If you're new to Medicare, and most of you are if you're listening to this, you probably read just enough or talked to just enough neighbors, relatives, and other folks to get really confused. My intention here is to simplify things for you dramatically. And the way I do that is just to point out that you really only have 3 options in Medicare. There are lots of different choices in those options, but once you understand original Medicare, Medigap plans, and Medicare Advantage plans, you really are going to have a very good idea of which parts of these programs you want and which ones you don't want, and which ones may be best for you. So that's what we're going to talk about today. We'll start with parts A and B, make sure you understand what those do and don't do, what they will cost, and then we'll dig into the things that are intended to cap costs that Medicare A and B don't cover. So to begin with, it's important to know when Medicare is going to begin. We get lots of calls from folks who aren't quite 65, sometimes in their 50s or even earlier, wanting to know when they can enroll in Medicare. People who are 65 and older are eligible, as well as folks who have been on disability, Social Security disability income for 24 months. Those are really the 2 generally most common reasons that you might be eligible for Medicare. So mostly we talk to folks who are turning 65 at this point. Your initial enrollment period, as it says here, lasts for 7 months. You can enroll in Medicare anytime up to 3 months ahead of your 65th birth month, or up to 4 months after, or 3 months after your 65th birth month. So including that month, it's 7 months. If you enroll in one of the first 3 months of that initial enrollment period, your coverage, your Part A and B coverage will actually begin on the first day of your 65th birth month. If you use one of these last 4 months, your coverage will begin on the first day of the following month after you enroll. Now, the decision, should you enroll, is an important one. Medicare is optional. A lot of folks that we talk to believe that it's mandatory for some reason. It's not. It is up to you. There are lots of good reasons why you would want to, and it would be advantageous to enroll in Medicare, but it's not mandatory. There's no law that says you have to. If you're turning 65 or you're eligible due to disability and you're not employed or insured by current employment, then you should probably choose to enroll in Parts A and B. Delaying Part B, as it says here, may result in a penalty, a premium penalty. Now, that word penalty that we use, I think, is a little misleading. You know, it's not much different than having car insurance, right? If you went a year without it and then decided that was a bad idea, you'd pay more for it when you decided to re-enroll. This is similar. It's not an enormous penalty, but it does cost you more every month once you do enroll, and it's a lifetime penalty. So it adds up substantially over the course of a lifetime. If you do have employer coverage, if you're currently working, it's not a retiree plan or something you got from your employer. This is insurance that you get as a result of current work, you or your spouse's current employer, and your employer has 20 or more employees, then you probably have what's called creditable coverage. And if your coverage is creditable, then you don't have to enroll in Parts A or B or anything else, and you won't incur the penalties until after you retire. You have 8 months to enroll after your current coverage ends. That would incur a pretty substantial gap in coverage, so we don't generally recommend you wait that long, but you can enroll anytime as long as you're still employed and up to 8 months after. Right. So that's when to enroll when you're first eligible. There are other enrollment periods. We're not going to talk about too many of them here, but I will point out this annual enrollment period more than once today because it's very important. This is your annual opportunity to make changes in Part D and Part C Advantage plans. Very important that you get in the habit of doing that, October 15th to December 7th. These plans are allowed to change basically everything: costs, benefits, what they do and don't cover, which doctors and hospitals they do and don't do business with. And so if you don't take advantage of this opportunity to compare your current plan with what's available in the following year, you can find you have some unpleasant and very expensive surprises awaiting you in the new year. So this is a really good habit to get into. So how do you get Parts A and B? This is done through Social Security, not Medicare. Okay. By far the easiest way to do this is to go online to ssa.gov, and there is a Medicare button at the top of the homepage, and in the drop down there's a tab that says Enroll in Medicare. Just follow that through and it'll take you 10 to 15 minutes to fill out the application. Again, you can do that up to 3 months ahead of your 65th birth month. Social Security is an enormous agency with serious challenges. I don't recommend you wait to the last minute to do anything with Social Security. So if you can get this done 3 months ahead of time, highly recommend you do that. You can also call Social Security to make an appointment to sit down with somebody at the local office. Now, if you have Social Security specific questions, or you just feel like you need some help enrolling in Medicare for some reason, you can make an appointment to meet with somebody at the local office. As of this year, they are no longer doing any of that over the phone. So if you do call them, be prepared to make an appointment. They won't answer questions or help you out once somebody answers the phone any longer. All right.
And can I ask you a question, Brad?
Yeah, sure, Dara, please.
Just because I think this is something, you talked about it a little bit about when you're still employed, and if you have creditable coverage and are still employed, do you still enroll in Part A?
Oh, thank you. Yeah, I appreciate that. So most people who are employed and will continue to work, go ahead and enroll in Part A because it has no cost and it provides a little bit of secondary insurance. So no reason not to. Most people also defer everything else, Part B and everything else, because they do have a cost and they generally aren't worth that cost as a second payer. Thank you, Dara. I
Thank you.
appreciate that question. Yeah. All right. Last thing to know is if you are already enrolled in Social Security, if you're receiving Social Security retirement benefits before you're 65, or you're receiving disability benefits, you'll be automatically enrolled in Parts A and B. That can cause some confusion for folks who are receiving Social Security benefits, but may still have employer insurance. That happens on occasion. In that case, you'll have to arrange to disenroll in Part B prior to your 65th birth month. All right, so once you have enrolled in A and B, this is what you'll get from Social Security, a Medicare and U-book. This is a 120-page, 8x10 introductory brochure. I don't recommend anybody tries reading this from cover to cover. It will only bore and confuse you, frankly. It's a nice little resource to have around if you have specific questions. The other thing you'll get, and more importantly, is your Medicare card with this number on it. This is your Medicare number, and it is as good as gold. Just like any credit card you have, the number can be used to bill Medicare. Once somebody has that in your name, they can be off to the races. Medicare is a $160 billion a year industry. So that's an enormous drain on the Medicare system. If we want to have it around long enough for us to take advantage or our children to take advantage, then we need to make sure that nobody is billing Medicare fraudulently on our behalf. So please take care of those Medicare numbers once you have one. Okay, once you also, some folks have, and somebody always asks about health savings accounts. If you happen to have one of those, they're tax advantaged accounts that you can put savings into to pay for medical expenses once you're retired. The contributions are tax deductible, tax advantaged. However, the tax deductions disappear once you're Medicare eligible. So in general, the advice is that people should stop contributing to their HSAs about 6 months ahead of their Medicare enrollment. But aside from that, I definitely encourage you to talk to a tax professional about the details of that and when you should stop making those contributions. All right, so we're ready to dive into Medicare itself and what it costs and what it does. I told you there are only two choices. There is traditional Medicare or Medicare Advantage Part C. We started talking about Part A and B a little bit, and this is what comes first. So we're going to finish with that option first. This is not really familiar to most people. So this is we're going to spend more time than anything on this option. Okay, so to begin with, let's understand Parts A and B. Part A is inpatient hospital coverage. Inpatient is a specific term. It means your doctor has signed papers admitting you to the hospital. You are now an inpatient. You can be in the emergency room. You can have an operation, surgery as an outpatient. You can be in the ICU. You can be in the hospital for weeks at a time and still not be an inpatient. And if you're not an inpatient, if you're an outpatient, then Part A won't pay anything. Okay, so can be very important and is something you should be asking your doctor when you're in the hospital. Am I an inpatient today or an outpatient? Is something you'll need to know. Part A for most folks is free. If you've worked 10 years or more, then Part A has no premium. You've already paid it. So the price is just right. Now there is a deductible. So if you're admitted to the hospital, the first $1,676 is your responsibility. So that bill will come to you. The rest of the next 60 days will be paid for 100% by Part A. So it's very good coverage. 60-day inpatient hospital stay is extremely rare, but it's not something you would want to cover by yourself. Now, two things we need to know about this. A deductible is generally, something that you pay before insurance pays anything, and it's usually an one-time annual occurrence. In this case, with Part A, however, it is per occurrence. So every time you're admitted to the hospital, you are at risk of having to pay this deductible. This is the first major expense that I point out that would like to find a way to cover if we can. Those options we'll talk about later, but this is the first one if you're keeping track. Now, if you're still in the hospital on day 61, you begin to pay a share of the cost. You'll pay about $450 a day for each day after day 61. If you're still in the hospital on day 91, that amount will double to over $800. And if you're still hospitalized on day 151, all of the costs are now yours. So if all you have is Part A to cover inpatient hospital stays, your out-of-pocket risks are unlimited. We don't like unlimited risks in this case. So we're going to talk about the two ways to cover that risk. That all makes sense, Dara?
It does.
Fantastic. Thank you. All right. So Part B, conversely, is outpatient coverage. Part B does have a monthly premium. It's $185 a month in 2025. And Part B covers virtually all your health care. So outpatient hospital stays, emergency room visits, urgent care, outpatient surgeries, your standard doctor's office visits, etc. Right? Virtually everything is going to really be covered by Part B. Part B also has a deductible. This is an annual deductible, and it's only $257 a year. So not a lot, but we will talk more about that deductible down the road. Now, Part B, in most cases, there are exceptions, but in most cases, Part B pays 80% for any covered service. So lab tests, x-rays, MRIs, CAT scans, surgery, what have you, doctor's office visits, Part B pays 80%. That leaves you with 20% to pay, which again, for $185 in the American healthcare system is a pretty good deal. However, your 20%, again, is unlimited in risk. There's no cap on how high it can go. If your bill is $1,000, you owe $200. And if it's $100,000, you owe $20,000. Again, we'll want to find and consider ways to limit that risk. All right, so that's parts A and B. Our base cost, this $185, is something everyone will pay once they're on Medicare. There's only one way to reduce or eliminate that, and that's to qualify for Medicaid. We'll talk about that towards the end, but for our purposes here, we're going to call that our base cost. And so take note of that, and we'll keep adding to it and see what it's going to cost us to cover those unlimited risks. So I said the next part of traditional Medicare is called a Medigap plan or a supplementary plan. People use the term supplement to mean just about everything in Medicare. I've heard it used for everything. These are the only plans that actually supplement Medicare. Okay, you keep parts A and B, the national federal healthcare system, and a Medigap plan pays its share of the balance of any bill. So if you had a $1,000 doctor bill, ran up some lab costs or something, then Part B would pay 80%, and the Medigap supplement would pay its share of the rest of the bill. If there was anything left over after that, that would be what you would pay. Medigap plans are standardized by federal law. There are plans, cleverly named plans A, B, C, D through N. Okay, we're only going to talk about a couple of those, and you'll see more why. So one, that narrows things down for us really quickly and limits what we're going to talk about. But in reality, there are really only a couple that are worth talking about because of the prices. And the last thing to know is Medigap plans pay their share when you get Medicare covered services or products. If the things that you're getting, for instance, if you get dental work done, Medicare does not cover that, and your Medigap plan won't either. So Medicare does not cover prescription drugs, for instance. And so the last major cost that we don't have covered that we'll want to get covered is prescription drug costs. All right, let's dig into what these Medigap plans actually look like. Across the top of this chart, you see all the plans that are listed, A through N, and C and F are held off to the side over here. You have to be 70 years old today in order to be eligible for plan C or F. I'm going to tell you a little bit about F just because it's simple. It's the most comprehensive plan available to anyone. And if you look over on the left side, you see some of the major costs that Part A and B don't cover, including the Part A deductible and the Part B coinsurance that we talked about. And I know we're here under Plan F, you can see that it ticks all the boxes. In other words, if you have Plan F and pay the premiums, then your out-of-pocket doctor and hospital bills are covered 100%. You'll never see a bill. Okay, these work very, very well, and they're more expensive than the alternative Advantage plans as a result. Okay, for most people who are under 70 years old, Plan G is the most comprehensive plan available, and it's actually a little less expensive than Plan F. So it's a better deal, slightly. Plan G, you can see, only leaves one box unchecked, and that's the Part B deductible. Plan F covers it, Plan G does not. And if you recall from earlier, the Part B deductible is only $257 a year. So with Plan G, you pay the premiums, and first time you go to the doctor, you may owe $257. Once that amount is paid, you're covered again for 100% for the rest of the year. Okay, so Plan G is also very, very good coverage. It's very, very simple. You see, the Medicare, the federal healthcare system, again, doesn't have some of the things that we've become used to with managed care, healthcare in the United States. For instance, there are no networks involved. We've gotten used to having to use network doctors or hospitals, or we end up paying most, if not all, the costs. Medicare doesn't have networks. Instead, Medicare just is accepted by 90% of doctors and hospitals in the United States. So your network is virtually all the doctors available. You can take Medicare because it's national. You can take it to any state in the country. Your Medigap plan goes along with it, and they will cover you. Okay.
Can I ask a question for you?
Yeah, please.
Brad? On the Medigap plans, are there coverage limits for skilled nursing facilities for those programs that do offer coverage?
Well, forgive me. No, there's not. Okay. There are coverage limits for Part A, and when Part A will cover skilled nursing stays. But Medigap plans pay 100% of the balance of skilled nursing care.
And that's specifically skilled nursing care where nursing care is required and is not assisted living or memory care, correct?
That's correct. That would be long-term care. So big difference. Skilled nursing is generally it's inpatient therapeutic care, usually, physical therapy following a surgery, occupational therapy following an accident, something like that. Custodial care, long-term care, memory care, those things are not covered by Medicare. The only way to get those covered is to have a long-term care policy in place before you need it, or to qualify for Medicaid, which will also pay for long-term care, but Medicare will not. Thanks, Tara.
Mm-hmm.
All right, so Plan G is the next most comprehensive plan. There's only one other plan that I actually talk about very often, that there's the footnote there with G, that refers to Plan G with a high deductible. Remember, Plan G's deductible is $257 a month. GHD's deductible is $2,800 a month. We're going to compare those two pretty closely here in a moment, and you can decide which one is preferable for you. In the meantime, it's good to know that Medigap rates are actually regulated by the states, which means that the state of Idaho has all the prices updated monthly from all the companies that sell Medigap plans. So if you go to our website, doi.idaho.gov/SHIBA, you can find these rate sheets. On the website, if you hit this button, Idaho Medigap rates, it'll get you here. And most of you are going to choose the non-smoker 65 rate sheet, and it will look like this. On the left, there's a list of all the companies that sell Medigap rate, plans in Idaho. And across the top is the entire list of plans, including our Plan G and GHD. Now, you can see that there is quite a difference from one company to the next for what you would pay for Plan G, for instance. $177 a month, $171 a month. Those are the lowest plans available. But you can also pay, $305 a month if you wanted. I don't know why you would, but you can do it. The reason I say that is because I just don't get complaints about any of these plans or companies. In nine plus years here, I've seen 5 complaints about Medigap plans. They're just so simple that they work very, very well. And so I don't get complaints about any of these companies. So I really can't steer you towards one that's better than any other. They all work very well. And so I have no reason to do anything but shop on price. When I'm helping people choose a Medigap plan, what I coach them to do is to choose one or two, maybe 3 of the least expensive plans, call each company, see who treats them nicest on the phone, and buy their plan. Simple as that. Okay. Now you can see also that Plan GHD is only $52 a month from Globe Life and Accident, $72 from Blue Cross of Idaho. So again, you can pay more, but there's not any reason to.
And what's that high deductible? What is the deductible on the high deductible? Does it vary?
It doesn't. The deductible for G is $257, no matter which plan company you buy it from, and the deductible for GHD is $2,800, no matter who you buy it from. So let's compare those two more closely. Let me point out that, for instance, if we go back up to our chart here, you see that Plan A covers less than half of what Plan G covers. And yet the costs for Plan A are virtually all higher than what we can get a Plan G for. This is why I say it's really not worth looking into A through D or K, L, M, or N. Let's look at G and GHD together, though, because I think it is a good idea to compare these two. Now, remember I said G is a better deal than F. G doesn't cover the Part B deductible, so it has this $257 deductible. Plan F doesn't. But G is available for about $400 a year less than Plan F. So it's actually, financially a little better deal than Plan F is. However, so let's look at Plan G in the light of a worst case scenario. you're going to pay the premium, and we can get it for $177 a month times 12. That's about $2,100 a year. That's money you're going to pay whether you use the insurance or not each year, right? Now, if you have a six-figure hospital bill, you're still going to pay the premium, $2,100, and you're going to pay the deductible, $257. So that's a total of $2,381, about $2,400, right? That's your total out of pocket for a six-figure hospital bill with Plan G. So that's pretty good insurance. If you have Plan GHD with a high deductible, it's only $52 a month. So the total annual premium bill is $624. And then if you have that disastrous hospital bill, you'll still pay the $600 and the deductible for a total of $34.94. If we compare those two total costs, you're paying $1,500 or more for Plan G, but only getting $1,100 more in benefits. In other words, we pay $1,500 less for GHD. And in the rare occurrence that you have that catastrophic bill, hopefully rare, right? Then you only get $1,100 more in benefits from Plan G, or you only pay $1,100 more out of pocket with GHD. So you're saving, if you choose Plan GHD, you save $1,500 a year every year. And in those worst case scenarios, you only pay $1,100 more out of pocket than you would if you had the full Plan G. Does that make sense, Dara?
I think so. So it really does make sense to do the high deductible if you have confidence you can cover that deductible. Is that what you would say?
I'd say that for people who are still very, very healthy and don't mind a little bit of extra risk, that Plan GHD is a very, very good option. For folks who already see a specialist for a chronic condition more than half a dozen times a year, Plan G with the low deductible is probably a wiser choice.
And once you're in G, can you switch to GHD? And once you're in GHD, can you switch to G?
Yeah, good questions. Let's talk about that. So let's talk about, say we're talking about why to choose and how to choose a Medigap plan. Right here, you have a brief window to buy a plan guaranteed. So Dara's point here is that Medigap plans are allowed to ask about pre-existing conditions, and they can turn you down. They don't have to insure you. However, you have a guarantee when you first eligible for Medicare. It lasts for 6 months. Your Medicare starts, the clock starts ticking. During that first 6 months, you can buy any Medigap plan on that rate sheet. They can't ask about your health, and they can't sell it to you for more than is published on that rate sheet. They can sell it to you for less if they want to, and some plans do offer discounts under certain circumstances. They can't sell it to you for more. After that 6-month window is closed, they will ask about your health, and they will make decisions about whether to insure you or not, based on what you tell them. So this is really the one decision you're going to make when you start Medicare that may be irreversible. If you choose not to buy a Medigap plan and then get a serious diagnosis down the road, you're not likely to be able to switch from an Advantage plan to a Medigap plan. Now, once you're in Medigap, if you have one, you do get an annual opportunity to shop around and see if there's not a better deal on your current plan or something else. So Idaho allows you, and this is described here at the bottom, Idaho allows you on your birthday and for 2 months after to go shopping, and you can buy any plan that has equal or lesser benefits without underwriting, without being asked about your health, and they can't turn you down. So it's a new guarantee each year. You can't increase your benefits, however. So if you have Plan GHD, you can't go to G or N with a guarantee. Okay, you can apply and they will underwrite you, and so you may get insured, but there's no guarantee that you will. Answer your question, Dara.
It did. Thank you.
Thank you very much. All right, so other reasons to buy a Medigap plan. Now, obviously, we looked at the premiums, and they are far higher than the free plans that you can get from Advantage plan companies. So why would you want to spend that money? First, there's the guarantee, right? This may be the one chance to get one. Now, and we also talked about the deductibles. Let me point out that they don't really act like deductibles. The Medigap plans are more like out-of-pocket maximums. By that, I mean, a deductible is something that you have to pay before insurance pays anything. But in this case, Part A and B pay their share up front. So if you had $1,000 bill, Part B would pay the 80%. You would pay the $200, and that would go towards the deductible. So before the deductible is met, you still have very good insurance coverage. Once the deductible is met, your coverage is 100%. So our deductibles are either $257 a year or $2,800 a year. That's compared to the average Advantage plan out-of-pocket maximum of $6,000 this year. It ranges between $4,200 and almost $10,000. So those out-of-pocket maximums are substantially higher than the Medicaps. Flexibility of care, I think, is even more important. So remember I said that Medicare is the national health plan. You can take it anywhere in the country. You can see virtually any doctor, go to any hospital in the United States. Advantage plans require to use their network doctors and hospitals, a much smaller slice of what's available everywhere, right? So if you have a Blue Cross of Idaho plan, for instance, you'll have to use their network doctors and hospitals. If you go out of network, you'll pay most, if not all, of the costs. So you've got to be a lot more careful about who you see. And it's becoming increasingly difficult to determine as doctors and hospitals come and go more frequently from these networks. It's a trend that we've been watching over the last couple of years increasing. So this becomes especially important if you already have severe chronic conditions. You should be looking at a Medigap plan, or if you have a family history that you're concerned about, or you just want to be covered in case you get a referral to someplace like Stanford Medical Center or Mayo Clinic or Huntsman's in Salt Lake. All three of those places in the last 12 months, I've had Advantage plan patients come to us for help because they had been declined care in those places, even though Idaho doctors have referred them, but they won't see them with their Idaho Advantage plans. If they had had Medicare with a Medigap plan, they would have gotten the care they needed with no problem. So those are the most dramatic examples of reasons you would want a Medigap plan. But even here, in Idaho or the Treasure Valley, where, there's a large number of doctors, the number of doctors coming and going from these Advantage plan networks is increasing dramatically. And it's not a concern for people who have Medicare and a Medigap plan because Medicare doesn't have networks. Does that make sense, Dara?
It does.
Okay.
While we're talking coverage, I'm going to go ahead and just ask a question that
Please.
That I hear sometimes. And what does coverage look like? You talked about Medicare being national and national coverage with 90%. What about international travel? If someone leaves the country, what does that look like?
Yeah, Medicare doesn't cover it, except in very rare specific situations. Medigap plans do cover a small amount of emergency services. It's about $50,000 in coverage, and it's very limited. It's emergency specific. Once the emergency is over and you're stabilized, the coverage ends. So it's really not sufficient. health coverage when you're overseas. Advantage plans, there are a couple that are now doing the same thing as the Medigap plans do. Again, a small amount of emergency coverage. So it's not, Medicare is never really sufficient for an overseas traveler.
Good to know. Thank you.
You bet. Good question. All right. Last thing I think you should know is that if you decide, if you want to try an Advantage plan to begin with, it actually extends your guarantee. You get a 12-month opportunity to change your mind. So you do have an opportunity to try out an Advantage plan and then go to a Medigap plan, and it lasts 12 months. So it extends that guarantee out for 6 months longer. And then if you decide 2 or 3 years down the road or 5 years down the road that you want a Medigap plan, you can always apply. They will underwrite you or ask about your health. But if you're still in good health, you will get insured. All right. So last thing we need, if we're going to stick with traditional Medicare, is Part D. Medicare doesn't cover our prescriptions. Medigap doesn't either. So we need a Part D plan to cover the things we get at the pharmacy. You're going to get one of these at the same time as everything else during your initial enrollment period. This is where this annual enrollment period, though, comes in. Medigap plans you can change anytime. There's no enrollment period required. But if with a drug plan, the only time to change drug plans is between October 15th and December 7th every year. And your new coverage, if you make a change, will begin January 1st. Part D covers the things you get at the pharmacy that your doctor prescribes and some vaccinations. Doesn't cover over-the-counter medications like cough syrup or aspirin or those kinds of things. The monthly premiums range from $0 a month. This year, there's one zero premium plan and well over $100. Now, I can tell you that paying more doesn't get you more. That zero premium plan is actually quite good and compares very well to $20, $30, even $40 plans very often. So, and somebody always asks, well, what if I'm not taking any medications? Why should I pay for a Part D plan? Well, this is your opportunity to get one for free and avoid the premium penalty that will add up if you decide to delay enrollment. So if you're not taking any medications or you're just taking generic medications, then that zero premium plan is a really good option. Somebody always asks, there are deductibles. Some plans don't have a deductible, but they can be as high as actually $590 this year. And I don't really, once you understand how to compare these plans, and I'm going to show you here in just a minute, the deductibles really don't figure into the calculations. They don't apply to generic drugs. The only time you'll pay a deductible is if you have a brand name medication. And the deductible is figured into the estimate that we'll see when we're comparing plans on Medicare.gov. So it's a part of the comparison, and really, if you don't take any brand name drugs, it won't figure into the calculations. And if you do, it will. And so I don't really use it to compare plans very often. Generic drugs will be usually covered 100%, and name brand drugs may or may not be covered. Your copays could be $50. It could be a percentage of the cost, or they could be the full retail cost if they're not covered at all. Now, each of these plans covers a different list of medications. And this is the most important thing about them. The only way to choose one is to use Medicare.gov, where you can create a list of your current medications, and it will give you a list of all the drug plans from most effective to least effective based on your prescriptions. It will also include in the calculation a list of pharmacies that you choose. So certainly you'll choose your current pharmacy, but you can also compare up to 4 others. And I can always tell you which ones are most likely to be preferred pharmacies. And mail order is an option on all the plans. It's not necessarily the most cost effective anymore, but it is an option. And Part D also has a premium penalty, I think I mentioned. So if you don't enroll when you're first eligible, you delay a year, you'll have an increased premium when you do enroll.
And will that increased premium be just the first year, or how long does that increased premium last?
For as long as you have Medicare. So probably the rest of your life.
A permanent penalty. Got it.
Yes. All right. Couple of changes to Part D. When I talk about before anything else this year, these are as a result of the, the Inflation Reduction Act. First is a low out-of-pocket threshold or out-of-pocket maximum. It was last year over $8,000 that you could be responsible for out of pocket for covered medications. This year it's $2,000, so far lower. Now the important thing to understand is this is only for covered medications. If you have a Part D plan and it doesn't cover one of your medications, and that medication is $1,000 a month, you'll still pay full retail price for it. If the name brand medication is covered, then the most you'll pay out of pocket is $2,000. All right. The other thing to be aware of is that they created a payment plan for prescriptions. And that's really useful for folks who have to pay those deductibles. In some cases, we see people who have extremely high costs at the pharmacy for the first 2, 3, or even 4 months. Could be $1,000, $500, something like that. The payment plan option allows your insurance company to spread those payments evenly out over 12 months. So there's no big balloon payments up front. You do have to ask your insurance company to create the payment plan if that's what you want to do. And then instead of paying the pharmacist for your medications, your insurance company will bill you for them. All right, so this is Medicare.gov, the government website, where we, and really the most useful piece of this is the Plan Finder tool, which you find right here where it says Find Plans Now. I'm going to go ahead and open up my browser and show you what this looks like. I hope I can do that. There it is, yeah. So this is what it looks like today. And if you press that button, Find Plans Now, you'll go to the Plan Finder tool. It will ask for your zip code and a couple other questions, and then it will allow you to put in a list of medications. And this is a very, very effective tool to use to compare Part D plans. It also says you can compare Advantage plans, which you can, and we use it for that. We do not use it to compare Medigap plans. They don't have updated information. They don't have a complete list of companies that are available. And so it's really not great for that. Hit the Find Plans button. We're going to tell it we don't get any help from Medicaid or Social Security, and we do want to see our medications. It'll allow you to put in some medications and create a list and then choose some pharmacies to compare. I've already done that. I put in just one medication. It's a rather expensive one that I thought would be interesting. Eliquis, in case you have heard of that. And this is the results. So there are 12 drug plans available in Idaho this year. And here's the list of plans. Now, this first plan is the most effective plan. Here's why. So it does have a monthly premium of $86, which is quite high. But the total drug plus premium costs, so the monthly premium, $86.80, plus the cost of your prescriptions for the year on this plan would be $14.24. So with Eliquis and the premium, total costs would be $14.24. If we go down the list, the second plan is only $6.30, but the cost go up to $1,674, so $240, $260 more, right? So this plan is less expensive, but it's not covering that Eliquis nearly as well. And if we go down the list, we'll find that this plan is much more expensive, and so the total annual cost goes up another couple $100. And that trend just keeps going as we go down the list. Even the free plan, WellCare right here. Oh, wait, no, Solar Script 44. I ran out of plans. And you see 44, now we're over $2,000. That's because of the premium, not because of the drug cost. The drug costs are still limited to $2,000 because it is covered on this plan. Okay, so pretty obviously that first plan, although it is rather expensive, is the most effective plan available. It's pretty rare that we go down the list very far before choosing a plan. There are rare instances where one company versus another might make more sense. Like I said, that's a pretty rare occurrence. This is a very effective tool for comparing drug plans. Let me go back to my slideshow. Any questions about that, Dara?
No, I think that's great.
Okay, so we use this tool all day, every day. We do help people compare their drug plans and everything else. So if you go through this and begin to understand what you need, but still want help choosing specific plans, we're glad to do that with you.
Actually, I do have one question for you,
Okay.
just because I think it was a clarification. I know that you need a Plan D with if you are in Medicare and Medigap. Do you use the same process to find prescription coverage for um, a Plan C or a Medicare Advantage, or does Medicare Advantage have their own?
Yes, you do use the same process. Let me go back here. So if you recall, when we signed in, one of the questions that it asked was, do you want to look at Part D plans or Part C plans or Medigap plans, right?
Mm-hmm.
We chose Part D, but it is also a good tool. And it's really the only tool available to help you choose Medigap or Advantage plans as well. It's just not quite as simple, because with Part D, you've only got the one benefit to compare. So the first plan is going to be the best plan in 99% of cases.
But
With the
then the big
Advantage
note
plans,
here, the note here though, is that you need a Part D regardless of whether you have Medicare Original or Medicare Advantage, right?
Correct. The Advantage plans just have Part D as a part of the package deal.
Got it.
Kind of look at, original Medicare as ordering a la carte. You get one piece at a time. You probably
Yeah.
pay a little more for it. You expect a little more quality, but you don't get all the bells and whistles. The Advantage plans that we'll talk about are package deals. So probably a better price. Might not get the same quality in some respects, but you do get some toy surprises as well.
Yep.
Right.
Got it.
So yeah, good questions. All right, so this is, I need to rearrange this, don't I? So if we chose that Medicare prescription payment plan, this is what it might look like. In the beginning of the year, Juan here might pay $500 a month for the first 4 months for that Eliquis. In fact, on most plans, he would. But if we split the payments up for the Eliquis, then it will look more like this. So it'll still pay $2,000. It doesn't save you any money, but it does certainly make it a lot easier to afford in those first 4 months of the year. All right, so that is traditional Medicare. Again, really important that people who want to be insured for those severe chronic conditions already have them. Consider a Medigap plan with Medicare to begin with. For folks who, one, feel very, very healthy and very, very lucky, the Advantage plans are great choices. And they're also really great choices for folks whom, $57 to $200 a month is just really not a part of the reality. Zero premium plans that cover everything are a really good option. So let's talk about these Advantage plans. Again, sold by private insurance companies. So now these are, remember I said that Medigap plans are Medicare supplements. Medicare Advantage plans are Medicare replacements. Okay, if you buy an Advantage plan, let's go back. If you buy a Medigap plan, your Medicare coverage comes from Medicare, the federal government. If you have a question or a problem, you're going to call Medicare. With these, you're going to have Medicare, but it's going to be Blue Cross of Idaho's version or United Healthcare's version or Humana's version of Medicare. They have to cover the same things. They can cover more, but they are allowed to do it in very different ways. I'll talk about that. That can be good or bad. The monthly premiums, more than half the plans, and they're in Ada County, where I am, there are 37 Advantage plans available. So you can see where, the plan finder may be more, is still a good tool to compare Advantage plans, but now you've got 37 plans instead of 12 with not just one benefit, but hundreds of benefits to compare. So it does get a lot more complicated. The premiums, most of the plans, half the plans in Ada County this year are free. So most of them statewide are also very low. You're going to pay something just about every time you use services. There's going to be a copay, maybe a percentage, a co-insurance anytime you see a doctor or go to the hospital. The plans are available really by zip code. So, if you live in Twin Falls County, you've got a different list of plans available than you do in Ada County, and Bonner County has their own list of plans available. There are some plans that do not include Part D. And every year we run into somebody who makes the mistake of thinking, oh, those plans without Part D have really good healthcare benefits. So I'll get one of those and a separate Part D plan. But you can't have both. So when you enroll in the second one, it kicks you out of the first one. Right. And then there's may not be anything we can do about it for the rest of the year. So that's a mistake. The plans without Part D are intended for people like veterans who use the VA to get their medications and don't need Part D. If you don't have something like that, then those plans are not for you. Okay. And then most of the Advantage plans, well, frankly, all of them include dental, vision, a gym membership discount, and some other benefits that can be really helpful. Now, there are two types of plans available, HMOs and PPOs. HMOs require you to use their network doctors and hospitals. If you go out of network to get your care, you're uninsured. Okay, you'll be responsible for the entire bill. If you have a PPO, these will still should pay something, but it's going to be substantially less than they would pay if you had stayed in network for your care. Okay. So those are the two types. HMOs tend to have lower premiums and slightly better healthcare benefits because they're getting better prices for your healthcare as a result of requiring you to stay in network. PPOs tend to have slightly more expensive premiums and slightly worse benefits or less generous benefits than the HMOs. It's not a huge difference, but if you're comparing two plans side by side and looking for differences, it could be what makes a difference. So when we're looking at Medicare.gov to choose an Advantage plan, these are the most important factors off the bat. The first one is still the medications. Medications, if you have them, are a known out-of-pocket cost. Most times we don't know if we're going to go to the doctor or a hospital or not, but we know we're going to pick up our prescriptions if we have some. So we want to make sure they're all covered, and if they're all covered, they're covered by that cap, right? $2,000 cap. If they're not covered, the cost can be substantial. The second most important consideration is this one, and this is more difficult to determine. Are your doctors and your preferred hospital in network? we've talked about why that's important, so that's fairly obvious. Finding out is more difficult. When I'm helping somebody choose a plan, if we narrow it down to 1 or 2 or even 3 plans, and really it's a toss-up to which one is going to be best, the next step is to call your doctors and make sure, ask their billing people if they're in network on any of the plans you're considering. They know who they can bill, right? The plans do publish a list of network providers. However, they are often inaccurate, not updated often enough. And as I mentioned earlier, one of the problems with Advantage plans that we're experiencing is a growing number of doctors and hospitals who don't remain in network for the entire year. So, the list may start out with your hospital and network, but sometime in the middle of the year, it may not be. The list won't know that, but your doctor or your hospital will. And let me just say, I don't know where you find a list of hospitals. So here in the Treasure Valley, it's especially important because we've got the 2 major hospitals, St. Al's and St. Luke's. Some of the plans only cover one or the other. And I don't know where else you would get that information all in one place except to call me, because I create a list every year. So you're more than welcome to do that. I just don't know where you get an accurate list. This year, for instance, just to drive the point home, Humana and St. Al's decided or failed to finalize their contracts at the end of last year. So they were still in negotiations while everything was being printed up for open enrollment. So their literature and their websites still say that St. Al's is in network with Humana, but they're not. So right now, we're dealing with a lot of folks who are needing to make changes and are finding, that their doctors are not in network, even though they saw literature that says that they were. So that's a trap you can avoid by just keeping my number handy, I guess. The next piece, and right on the front page, that front page of Medicare.gov, the out-of-pocket limit is going to be one part of the list. So there'll be the premium plus drug costs, and the next number is going to be your out-of-pocket limit. Like I said, that ranges from $4,200 a year to over $9,000 a year this year. So it can be substantial, and it is certainly, if I'm looking at plans that have relatively similar benefits in other respects, if one has a $6,000 out-of-pocket limit and the other has a $4,500, well, there you go, right? So that's a good one. Finally, you can look at the healthcare benefits. You certainly should. Medicare.gov will tell you what the copays at your doctor are and what at specialists, and it will tell you what your coinsurance is for lab tests and MRIs and what you'll pay per day for a hospital stay, inpatient or outpatient. You'll notice that the difference between plans is not substantial. It can be significant, but it's not a huge difference from one plan to the next in general. So the next thing that really sways most people is the extra benefits and how much is available. This varies greatly. It can be from very, very little, less than $500 a year for dental, to $2,000 a year for dental this year. Same for vision. It can be, doesn't pay for any eyeglasses to has a $200 copay or $200 limit for glasses. And they have other benefits like over-the-counter medication benefits, so you can get things paid for like your cough syrup and aspirin and pain, those type of things. So that's how we go about that. Now, again, I'm going to mention this annual enrollment period. Super important that you get in the habit of comparing your Advantage plans every year, because everything we've talked about can change from one year to the next. And probably the second most common call I get right now this time of year is from people who are finding out in January that something changed and they didn't bother to look. So what do? Not the position you want to be in. You can always call us for help with these issues. If you have a trusted insurance agent, they can help you as well. You can always call the plans directly to enroll or to ask questions, and that's a really good idea. And Medicare.gov is great for comparing. It's also important that you create an account at Medicare.gov. It will allow you to just drag and drop your medication list into Plan Finder for one reason, so that's really helpful. It also allows you to see your bill monthly or your explanation of benefits monthly instead of quarterly. If you don't do that, Medicare will mail it to you quarterly, and that's not often enough to prevent fraud. So it's a good idea to create that account. How we doing, Dara?
Doing fine. You just finish up as much as you
Keep
like.
rolling.
We're
Okay.
good. Yep.
All right. So that's pretty much the dog and pony show, right? You got your two choices. Got traditional Medicare with a Medigap plan or an Advantage plan. I guess we didn't really talk about some of the disadvantages of the Advantage plans. Now, obviously, they have very low prices. They have those extra benefits that we talked about that can be very important. But they also have some hoops to jump through. One of the big ones is those networks. And if you were to get a referral to an out-of-state, one of the elite medical centers out of state, it would be a big problem. Not saying you necessarily wouldn't get care, but it would be more difficult and you may not get care. Also, Advantage plans, managed care requires you to get referrals to see specialists. It requires you to get prior authorization before you get anything aside from a checkup done. Or something to that effect, right? So if you don't get that prior approval, they won't pay for it. So this is where, with Medicare, you're in charge, you and your doctor are in charge of your health care. If you need to see a specialist, you find one and make an appointment. If you need knee replacement surgery, you find a surgeon and you arrange to have it done. With Advantage plans, you've got to get the insurance company's permission, as it were, to have the knee replacement surgery done. And if you don't do that ahead of time, you're on the hook for the whole thing. So you have the insurance company also involved in your healthcare decisions. That's a bit of a downside. And then there's just the stability and predictability of Medigap plans. They work very well. They remain the same as long as you own them. The only thing that's going to change is the price, which of course tends to go up like everything else. And Advantage plans, if that's the way you want to go, I just encourage you to really make use of all those extra benefits. Most people don't. And so if you have dental and vision benefits, certainly really worthwhile to take advantage of them and use them every year. All right, with that, I do want to spend a little bit of time talking about programs that are available for people who have problems paying for any of this. There are three. Social Security has a program called Extra Help. This will help pay for medications. In fact, it will pay for a drug plan, and it will limit the amount you pay for covered medications to no more than $12 and change. So as long as the drug is covered by Part D, the most you would pay for it is $12. Okay, most medications would be much lower than that. So it can be an enormous help for some folks. The others are Medicaid, which is a state-run program that can help. Medicaid and Medicare together are basically a Medigap Plan F, pays 100% of doctor and hospital bills. So we can help people understand whether they might be and how to enroll in Medicaid or how to apply for it as well. And then there are Idaho Medicare savings programs. These are also administered by the Department of Health and Welfare, the Medicaid office. And they act like partial Medicaid plans, basically. So they will pay the Part B premiums. So that $185 a month, no longer coming out of your Social Security checks if you qualify, Medicaid will pay for it. It will also pay for a drug plan. It will get you enrolled in extra help and may pay the balance of doctor and hospital bills, depending on how much you qualify for as well. Oh, I just rolled through these, didn't I? The danger of PowerPoint. I tend to skip ahead. So here's a look at this year's income guidelines for extra help. For instance, the monthly income limit for qualification for extra help is $1,883, and your assets are limited to $15,720. This does not include your home or one car and certain other assets, so you don't have to worry about those things. But if your income is, within $100 of any of these limits, I still encourage people to apply because there are exceptions. But these are all of the Medicare savings programs and what they do and the income limits, and here's extra help. All right, so we talked about making an account on Medicare.gov. If you do look at your Medicare.gov account or your explanation of benefits and believe fraud has been committed, you're being billed for something that you didn't receive or billed by somebody that you didn't see, then you can call the Senior Medicare Patrol in Idaho at 800-247-4422. Their job is to investigate Medicare fraud and report it appropriately to the FBI or CMS or what have you.
If there has been Medicare fraud, does a Medicare recipient have any responsibility or liability for that?
Maybe for better, for worse, no, in general, right? So they're billing Medicare.
Right.
However, we all suffer as a result of that. Like I said, it's $160 billion a year problem.
But if somebody
very
has
easy, but
gotten your number and used it nefariously, you're not liable for that, right?
No, that's true. All right, finally, last thing I have to say is if you've watched this entire show and had any fun at all, or just feel like you know it all, or would like to learn more, we train volunteers to become certified Medicare counselors. There are 6 folks who do what I do here in Idaho, 2 in Coeur d'Alene, 2 in Pocatello, and 2 here in Boise. That's not enough to serve the thousands of people that we do take care of every year. So we have a core of volunteers who also do Medicare counseling, and would love to hear from you if that sounds like it might be fun. So Dara, I think that is all I have. You're welcome to call me anytime. You can ask for Brad at this number, and I'd be glad to talk to you if you have more questions or want some help with your Medicare.
Well, thank you so very much, Brad, for such a comprehensive overview. And if anybody's made it this far, they are educated and ready to call you. But hopefully this provides a resource for you and others to send people to for that training. This will be on the LEARN website. So if you need more information, need some help, as Brad mentioned, please reach out to him at the State Health Insurance Benefit Advisors. Lots of help there for you. And we invite anyone who felt this was valuable to please join us on our LEARN mailing list to receive a monthly newsletter with links to our new and featured free education sessions on aging and caregiving topics. Thanks for joining us.